Hello guys, welcome back to my YouTube channel Knowledge is Power. Today I'm here with you all to discuss about the management of labor. I will be discussing the different stages management. So without wasting much time, let us start with the management. So firstly I will discuss about the management of first stage of labor. Afterwards I will discuss about the management of second stage of labor, and at last I will discuss the management for third stage of labor. So guys, if you haven't watched the video regarding the normal labor, then you can go in my description list and you can watch the first part of labor. In the management of first stage of labor, we have to prepare the patient in such a way that the mother will give natural birth. Then we have to monitor carefully the progress of labor. We have to monitor both fetus as well as the mother conditions, so to detect any kind of intrapartum complications earlierly. So here it consists the basic evaluation of the current clinical conditions. The first stage of labor, it includes the three stages. Firstly we have to do the assessment of the mother, then we have to provide some care as well as preparation for the delivery, then at last we have to plot all the condition of the mother in the partogram graph. So I'll be discussing about partogram in my next video. So at first we will do general assessment. So thorough general and obstetrical examination is necessary, including the vaginal examinations are to be carried out and recorded. Records of antenatal visits, investigations, reports, and any specific treatment, if it is given, we have to review everything. We have to take history of the client. Women's antenatal record is also reviewed, already I have mentioned. Then if there is no records of antenatal care, we have to take thorough history of the client. In the examination, we have to assess the pallor, edema, abdominal scar. If there is a previous history of cesarean surgery, then vital signs we have to check blood pressure, pulse, respiratory rate, and temperature of the mother. Then we have to auscultate the heart and lung sound for detecting any kind of abnormality. Apart from that, we have to explain about the antiseptic dressing to the mother previously before the delivery. We have to give encourage the mother, provide her with emotional support and assurance. Apart from that, we have to provide position. uh, Generally a woman in normal labor may not be confined to bed. While in bed she may take the position most comfortable to her. She should avoid dorsal supine position to avoid aortocaval compression. Then coming for the abdominal examinations, we'll check the presentation, position and engagement. Then we'll auscultate the fetal heart rate. Then at last we'll evaluate the uterine contraction. Then coming for the vaginal examination, so here we'll check the dilatation of the cervix in centimeters in relation to hours of labor. Then we'll note the progress of labor. To note the position of the head and degree of flexion. Then again we'll note the station of the head in relation to the ischial spines. Afterwards, we'll check the membranes. So we'll check whether the membrane is intact or the membrane has been ruptured. After that, we'll check the cervix consistency, position, dilatation, and its effacement. We will also check the adequacy of pelvis. After this examination, investigation is necessary. So investigation for the presence of protein in urine, sugar, ketones is essential to identify any kind of high risk pregnancy. Then in the blood investigation, we'll check for CBC, that is the complete blood count. Then we'll check the RBS status. Then we'll also check the blood grouping, if any kind of cross match is present or not, to detect any high risk cases. Then coming for the preparation and care, we can provide enema to the patient with the help of soap and water, and sometimes we can use glycerin. Then coming for the bladder care, patient is encouraged to pass urine by herself, as full bladder often inhibits urine contraction and may lead to infection. If the woman cannot go to the toilet, she is given a bedpan or a catheter can be inserted. Privacy is needed to be maintained and comfort must be ensured. If the patient fails to pass urine, especially in late stage, we have to follow the aseptic technique with full precautions in order to do catheterization. Then coming for the nutritional diet, if there is delayed emptying of the stomach in labor, low pH of the gastric contents is a real danger. So food is withheld during active stage of labor. Fluids in the form of plain water, ice chips, or fruit juice may be given in early labor. Intravenous fluid with RL solution can be started to maintain adequate hydration by IV routes. Then perineal saving is also necessary in some conditions where perineal saving is not necessary when it is associated with febrile morbidity, wound infection, and neonatal infection. So in such cases, perineal saving is not necessary. Otherwise, in normal condition of the mother, if the mother is fit and fine, then perineal saving is mandatory. The most important thing one should remember while giving management to the mother, so we have to monitor the progress of labor. Once labor has become started, so already I have mentioned that it is necessary to record all the events of the mother as well as the fetus in the partogram chart, so that we can detect the well-being of the fetus, well-being of the mother, and the progress of the labor. All the patient information like name, gravida, para, hospital number, date and time of admission, and time of rupture membrane is needed to be noted in the partograph. Afterwards, condition of the fetus. So we have to check fetal heart rate every half an hour. We have to note the membrane and liquor every vaginal examination, whether the membrane is intact. Then we'll give I. If the membrane is absent, then we'll give A in the partograph chart. If the membrane is clear, then we'll give with the symbol C. If there is passing of meconium stool by the baby, then we'll give M. If there is presence of blood, we'll give with the symbol B. Then we'll check the molding of the head. So if it is 0, then separated. Then if plus sign, it denotes touching. Then if it denotes 2 plus sign, the overlapping of the head. Then if 3 plus sign, it denotes severe overlapping. Afterwards, we'll monitor the fetal heart rate with the help of different monitoring devices. So we can also use auscultation methods. We can use electronic monitoring device like cardiotocography we can use in order to assess the fetal heart rate. In the coming diagram, it has been shown the normal and abnormal fetal heart rate. After that, we'll check the progress of labor. I have already mentioned we have to check the cervical dilatation. Also, we have to check the descending of the head of the fetus. Then we'll also check the contraction. And at last, we'll record the progress of labor in the partograph. So guys, this is all about the management for the first stage of labor. So in my coming lecture, I will be discussing about the management for the second stage of labor. Also, I will discuss about the management for the third stage of labor in my coming lectures. If you guys are new to this channel, please don't forget to give your valuable feedback in the comment section below, and don't forget to like, share and subscribe my YouTube channel. Till then, take care and goodbye.